Assalamualaikum to Dr. Rabiatul Munirah. My name is Nurhanis Binti Sanusi, and today I will be discussing a very important issue that Malaysia is facing right now: the increasing costs of healthcare and what the government is doing to manage and reduce these costs. Over the past few years, healthcare costs in Malaysia have been rising at alarming rate, and there are few key reasons for this increase. First, Malaysia's population is aging. As people get older, they tend to have more health issues, which require expensive treatments. Secondly, the number of people with chronic diseases like diabetes, hypertension, and obesity is also increasing, which further drives up healthcare costs. Lastly, there is also growing demand for specialized and high-tech medical services that come with high price tags. These rising costs have made it difficult for many Malaysians to afford the medical care they need. In fact, many people, especially from lower income groups, are struggling to access quality healthcare. To address this problem, the government has stepped in various measures to try and bring down these costs and ensure healthcare remains accessible to all. One of the main strategies that the government has taken to manage this increase in healthcare costs is to focus more on primary healthcare. Primary healthcare includes basic health services like preventive care, early diagnosis, and treatment for chronic diseases. It's more affordable and sustainable compared to expensive hospital treatments, and it helps to catch health problems early before they become severe. The government has introduced initiatives like clinics in Malaysia to help provide affordable healthcare to people who may otherwise not be able to afford treatment. These clinics offer general health services, usually provided by a general practitioner to lower income groups. By making healthcare more affordable, this clinic aims to ease the burden of public hospitals, which are often overcrowded and overwhelmed with patients. In addition, to improve primary healthcare, the government is also investing in digital healthcare services like telemedicine, where patients can consult with doctors remotely through video calls or online platforms. This is especially important in Malaysia, where there is a significant gap between urban and rural healthcare access. While the government's efforts are promising, there are still additional strategies they could explore to further reduce healthcare costs. Firstly, expanding healthcare insurance coverage. A significant portion of Malaysians currently do not have insurance, or they are underinsured, meaning they don't have enough coverage for medical treatments. This forces many individuals to pay out of pocket for their healthcare, which can be a huge financial burden. By offering affordable healthcare insurance options and extending coverage, especially for low-income families, the government can make healthcare more affordable and reduce the out-of-pocket expenses for Malaysians. Secondly, public-private partnerships. Another avenue that the government could explore is increasing collaboration between the public and private sectors in healthcare. Public-private partnership can be very beneficial, and the private sector can bring a new and innovative technologies to improve healthcare and services, while the public sector can ensure these technologies are made available to the broader population at affordable prices. These healthcare interventions will have a significant impact on the country's public finance. Initially, there will be more government spending to implement these programs, such as building new clinics, buying medical equipment, and training healthcare workers. However, in the long run, these investments will pay off by focusing on preventive healthcare and improving access to affordable treatment. The government can reduce the number of people needing expensive hospital treatments. This will relieve pressure on public hospitals and help control healthcare spending in the future, ultimately leading to long-term savings. Next, on societal level, the government intervention in healthcare will improve the overall quality of life for many Malaysians. By making healthcare more affordable, especially for low-income groups, people will be able to access the medical care they need when they need it. This will lead to healthier individuals, fewer hospital admissions, and less reliance on expensive treatments. As a result, society as a whole will benefit from a healthier population, which will also contribute to a more productive workforce. In conclusion, the rising cost of healthcare in Malaysia presents a serious challenge to both the economy and the well-being of the population. The government has already made positive steps, such as reinforcing primary healthcare and promoting digital healthcare services. However, more needs to be done to address the root causes of these increasing costs. By expanding health insurance coverage, focusing on preventing care, and fostering public-private partnerships, the government can make healthcare more affordable and sustainable for all Malaysians. While these measures will require a significant initial investment that will lead to better health outcomes and long-term saving for both government and society. That's all from me. Thank you.